How do you taper off Klonopin safely? If you or someone you know is facing Klonopin addiction, you might be wondering how to taper off this medication safely. Klonopin, or clonazepam, is a long-acting benzodiazepine often prescribed for anxiety and panic disorders. When taken for a long time, the body can become dependent on it, making it tough to stop without experiencing withdrawal symptoms. Tapering off Klonopin is essential to minimize withdrawal risks and support recovery. Stopping suddenly can lead to severe withdrawal symptoms like anxiety, insomnia, and even seizures. The tapering process allows your body and brain to adjust gradually, lowering the chance of dangerous withdrawal effects. So, how does tapering work? It involves a planned reduction in the amount of Klonopin taken each day or week. This process should always be guided by a healthcare professional, such as a doctor or addiction specialist. The most common method for tapering off long-acting benzodiazepines like Klonopin is a direct taper, where the dose is decreased in small steps. There are a few tapering methods to consider. The direct taper is the standard approach, where the dose is slowly reduced at regular intervals. Another method, called a substitute taper, involves switching to a different benzodiazepine before tapering off. However, since Klonopin is already long-acting, this method is less common for it. A micro-taper involves very small, precise reductions, often using a scale. This method can help those sensitive to dose changes. Some people may also consider a liquid taper, but this is not recommended for Klonopin due to its poor solubility in water. To taper off Klonopin safely, start by consulting a healthcare provider. They can help create a tapering plan tailored to your specific needs. Next, set a tapering schedule based on how long you have been taking Klonopin, your current dose, and your overall health. Reductions are usually small and happen over weeks or months. While tapering, it is essential to monitor your symptoms. Keep track of any withdrawal symptoms and report them to your healthcare provider. If symptoms become severe, adjustments to the tapering schedule may be necessary. Additionally, consider using support services like counseling or support groups to help manage the emotional aspects of withdrawal and recovery. Avoiding alcohol and other drugs during this process is also important, as they can interfere with tapering and increase the risk of complications. Common withdrawal symptoms include anxiety, insomnia, irritability, and physical discomfort. Severe symptoms like seizures are rare but possible, especially if tapering is too rapid. Having a strong support network can make the tapering process more manageable. Friends, family, and professionals can provide encouragement and understanding. After successfully tapering off Klonopin, ongoing support and treatment can help prevent relapse and support long-term recovery. Tapering off Klonopin safely requires a gradual, medically supervised reduction in dose to minimize withdrawal symptoms and support recovery. Working with healthcare professionals and following a structured plan is key for anyone facing Klonopin addiction.